There.
Yeah.
Hey.
Hey.
Holiday Live.
Here we are.
Getting settled in.
Hold on.
Welcome
we
to
gotta,
our happy home.
Do something. Stick this over
It's gonna
here.
be fine.
It's gonna twist. Shush.
There you go.
But we're like twisted a little bit.
Let's just slide it down. Hey everybody. We're just getting kind of settled in. We just got in from work, so I'm sorry.
Look who I got here with me today. Oh. This plug's closer over here. Right there. So I got Dr. Justin with me today, and we are going to... No, hey, Justin, that one's closer.
Okay.
Talk about a few topics and whatever anyone else wants to hear. And we are... Here he comes, Mr. Jingle Bells.
Jingle balls.
Mr. Jingle Balls.
Wait, hold on. Wait.
He's crazy. Wait, Alexa, turn on Christmas music.
Here's a station you might like.
I hope it's a station that I like.
Better be.
Better be. We're firing Alexa.
Is this Christmas music? Yeah. Oh, I'm spilling all over myself. So, we had a lot of exciting new things happen to us this year. We wanted to summarize it up.
Alexa, quiet down. All right, it's nice and soft.
Now it's softer.
Where's the Yule log? We should put one in the background.
I want my eggnog. You like eggnog.
It's all jumbled up and stuff.
Well, because I have big font.
Wave and wave. We got big font because we're old. You should see our font. It's like this big on the screen. That way we can see. Even with my glasses. No.
So we are going to talk. Here, can we bring
Here
this
we go.
on? There we go. I'm going to start moving things around.
Toya
Hold this for a second.
Hawkins hair, and it makes me. I want to say Tony Hawk. What? Tony Hawk's in here? No, but that's not right.
There, that's better maybe. So it's like eye level. That's better, right?
Yeah. How's it going, everybody?
Yay!
All out there. Did you see if they can spot the? Tyler was wondering if we were gonna have our.
Mistletoe?
No, the ornament that's up there, that our special ornament.
Oh.
Our inappropriate
I want to show you guys this ornament that we got from one of our friends. Whoosh, whoosh, whoosh. So this is a special ornament. I don't know if you guys can read
it's
it.
kind of flipped, huh?
It is backwards.
Flip it around.
Look how smart you are. So this is the, we're seeing it from the other way, but can you guys read that? What it says, like, and then it says 2020 on the end.
It's so beautiful.
It's so beautiful. And then, it goes like this, and here's 2020.
This is a snowflake. Snowfuck.
Isn't that a beautiful snowflake? So our friend got it for us. And we got some good ones here. We'll put over it so everybody can see it.
Just so you know, we just walked in the door. We just came straight from the office, fired up the live, and here we are for you guys and us and whoever's feeling good right now.
Got your loving family around you.
I'm acting like I'm drunk now, but I got some nice sparkling water.
Yeah, and I got water over there too. So what?
For those out there, I don't drink, so if you send any alcohol, bring in alcohol. Thank you, but we don't drink it. Well, maybe she will drink a little bit, but not even her really. So play golf. I like golf.
Are you asking for presents, Reva?
No, but I noticed if you watch, like a friend of mine is a plastic surgeon. He's always getting gifts. He gets so much gifts, and a lot of it's alcohol. It's like one bottle after the next, and I'm just like, man, how much alcohol can you get?
That plastic surgeon's wife just bought me these beautiful earrings. I don't know if you guys can see them.
Wow. Show off. Gifts.
She brought me this today, and she brought me 2 lipsticks.
Lipsticks. From them?
Yeah, who's that?
Hermes. I don't know. Yeah, your font's too big. I can't see it. The font's so big that it
Okay,
separates
stop,
words.
stop, rubbing it in. So she got me these two.
What's so special
Lips.
about those? I mean, besides
They're
that they come
Hermes's
from your friend.
new lipstick line. So
Okay.
let's see. For all of you guys who want to see what they look like, you go like this, and you get this box, and then and then you get this, and then there's this like woven little pouchy pouch.
This is all about like the display, right? It's all about the presentation. And then you open it up again, and there's like a little Russian doll in there.
And then you.
Oh yeah,
here's
Mrs.
what
Mac. Yeah, it's a thing. Yeah.
It is a thing.
Yeah.
Okay, so that's one color. So it's Hermes's.
The Christmas tree.
What does that one say?
It says Amazon.
Rouge?
Amazon? Oh, Rouge.
Rouge
Amazon.
Amazon.
Amazon. But what, like seriously, what's? I mean, I get there's different qualities.
It's all about the packaging.
Stuff, but like.
It's all about the packaging. It's all about the packaging.
Yeah.
Okay, so
Well,
we've
maybe
got-
the quality's like great, so it sticks on better.
and the other
stays on
color that I
better,
got,
or
and I'll show you
uniform.
this one. This one is
Hey, look,
beautiful
it's
too.
good packaging again. And there's a
So
little
this one's a
Russian
different
doll in
color.
this one too.
Look, this one is blue, and then this one. Let's look.
I do like the color scheme.
Yeah,
That's
it's
nice.
pretty, right?
It makes your counter look nicer. Right? When you set it on the counter, right?
And this one is this color, which is nice. It's kind of the color I thought.
Aren't you supposed to put it like on your wrist and show it? Like, what is that?
It's the back of the hand,
Oh.
but no, we're not gonna do that.
No.
No. Okay, so what have been the new things that have come to our practice to Ideal Face and Body in 2020? Even though 2020 was a crappy year, but what were the positive things that came out of it?
I'm tired of saying it's a crappy year.
It was a crappy year.
Even though it's a crappy year. Because still, it's still good to wake up in the morning and put your feet on the ground and you're alive and,
Blah,
that,
blah,
no,
blah,
but that's
blah.
okay, right? Like, you have to be, like, baseline happy. I know there's a lot of things that are tough out there, and we've gone through our tough times, and we have some tough things going on now, and personally, and I'm sure everybody does, and so, it's not all so rosy, even though we, make it look like that, because it is. No, but... I don't know what's new this year. I mean, a lot of new patients, right? Every year, every day is a new patient for the most part. There are some obviously returning patients and loyal patients, and that we see often. But
Well,
that
let's
was
look
the
at
first
my
thing that came to mind.
notes list. All right, why don't we look at this list? Besides our amazing brand new patients, and we had a lot of our great patients refer their friends and their family and people they knew, and so our practice has gotten a lot, I hate to use the word richer, but kind of, with great people, great people come through the doors. We love that. But we have also added some new products, right?
Ooh.
So let's talk about the new products that we've added in 2020. We've added a new filler.
Mm-hmm.
We've added 2 new fillers, actually. We added Wrestling Kiss. We added Wrestling Kiss, which is supposed to be like the best thing for the lips. And then...
Wait, supposed to be, or what do you think? There's I don't know. There's
There's
something hidden in that comment. No, but elaborate on it, right? If it's supposed to be like, and obviously it sounds great. They got the kiss in the name, and that sounds awesome. I think that.
Yeah,
but
it's a
does
great
that really-
marketing and great, but it doesn't necessarily translate to the best, but it's a good filler, and it's a good filler. I mean, that's all I have to say.
Are you using it?
I've injected it in some people, but
Are people requesting it?
no one's coming in requesting it.
So they're not doing a very good job marketing it, huh? No, but I mean, I'd say let's just kind of hit that topic for a minute. We can go one by one, but when people come in, do you find that they're requesting a certain product to be put in, or are they more like, hey, what do you think's best? I'll leave it up to you.
Right. Most of the time
That
they come
one.
in and they're like, I want my lips done. I'm ready for it. And then I say, okay, well, what do you want it to look like? Do you have a photo? Because everybody has a photo on their phone of their like dream like look, lips, outfit,
Yeah, you know
whatever.
what mine is? You.
How did I know you were going to say that? You know, that's why we've been together almost 20 years. Well, actually, it's been more than 20 years, right? 1998?
Who's counting?
Well, I don't know. I am, I guess. So they come in and they say, well, I want great lips. And I say, what do you want it to look like? And then they show me a picture. And then I pick the filler depending on that. And also depending on their age, depending on how strong their lips look. Or if they look like they have soft, mushy lips, or they're older, I may choose a softer filler. It just all depends, you know?
Merry Christmas, Dave Goldfarb.
Dave, for my birthday, got me yellow roses because he couldn't attend, so that was very
He
sweet
sent
of
his
you.
ambassadors, though, remember? And you sent your ambassadors to San Francisco, I see. This is somebody that's on here, and we know each other very well, so if you don't follow that, you shouldn't because it's all inside. Anyway.
So it was Wrestling Kiss was one, and then we have a whole new line of fillers, which is exclusive to certain practices, exclusive to only like a few practices in Beverly Hills. We happen to be one of them, and that is Revance line of fillers. That's RHA 2, 3, and 4, right? Yeah, 2, 3, and 4. And I have been using those. Those are very nice.
Those, yeah, you like, right? I mean, there's a lot of positivity.
They're very
to that.
soft. They don't look bulky when you inject them, and they last for 15 months.
Hey, it's Captain Barron. Sorry, I don't mean to everybody's coming on. What's up, man? When your name pops up, I think of like dolphins swimming next to the boat and all the sunsets.
I
and
think
the
of
views.
Sage.
You think? You know what? I think of Sage too. I see you posting Sage, and I'm jealous, man, because you guys are having a great time, and you're doing things together, and you're traveling, and he's growing up to be like it looks like a fine young man, you know. So kudos to you, man.
Yeah, we haven't been out. I don't know if he still lives in Hermosa, but it's always fun to go there.
And my heart goes out to you with your dad, because we met him, and so love you too, man.
So that was the first thing. So we talked about that. Coming back to this.
Okay.
So we have the 2 new fillers, Wrestling
I like people. I can't help it.
That's fine.
Oh, you got married. Yeah, you know what? I did see you.
We got married?
Yeah.
Why did we get the invite to the... I didn't get an invite. Did you get
it? Why are you thinking like that? Yeah, it's not me.
Did you get married?
It's him.
It's me.
No.
Where was my invite?
No, I saw I saw you post something about that, and it looks great. Yeah, focus. It looks wonderful. You know, your son and your wife and all that stuff. So
I didn't see any photos.
I'm happy for you. You got to pay attention.
Congratulations, Matt.
Eloped due to COVID. Man, don't put COVID in there.
Well, we can celebrate that.
So
your elopement, my birthday.
I'm sorry. You were talking about the Revance, and the Revance.
You paying attention to me again?
Yeah.
Oh, thanks.
The Revance is the filler that you're really like. You're really positive.
I'm positive about it. It's new. I'm going to give it a shot this next 2021. I like the product. It's soft. It's great. It lasts 15 months, so maybe my patients will be happier. I have a lot of patients that work out a lot and feel like they burn through their filler quickly. So maybe this is a good alternative. So I'm positive about it.
Because it lasts. You think it lasts longer?
Well, they said it's going to last 15 months, so only time will tell. So 15 months.
Yeah, and just she's very positive about it. I know, like when she's talking about it, or like the rep will come and they really powwow and talk about the product quite in detail, and I can just tell there's a good vibe about it. And when there's a good vibe, that means there's good results, and you like injecting it. No, just positive all the way around.
That's right. So another thing that we did that was
Ashley
new.
in the house.
Ashley.
Ash.
You can't be that far from us, so just show up. You know what time it is. No, I'm kidding. So what else? Another thing that was new was that we changed the way that we do our consults. We're doing them virtually now. There she is. Let's see. Ashley may have some for us.
Oh, yeah?
Yeah, let's see. Let's see if she's going to announce it. Waiting for Ashley to join.
Okay.
Hey, guys.
Hi. So did it happen yet?
Yeah, it happened. He said yes.
Yay!
So we are here in Beverly Hills. The groom just pulled off. I was trying to get him, but They said
You-
yes. So
You should clarify
Yay.
that it's not you getting married. You said
it's not
yes.
me. It's not me. It's not me. But I just saw that you guys were live, so I wanted to come and say hi and share the good news that love
Yay.
is in the air.
Oh, that's
Yay.
great. Did he
So-
get on a knee?
Ashley's
got on one
best
knee.
friend. Let people know what's going on. Ashley's best friend. We don't have to say
My
who it is.
best friend of,
Since, like, no, clarify though, from since you were like that big, right?
I mean,
Riding
well
horses.
over 20 years.
Right.
Just got engaged in Will Rogers Park in Beverly Hills. Right?
Oh, wow.
And we were hiding in the bushes, and it was
That's
just,
typical though.
it was like crazy. It was crazy. The park rangers wanted to shut it down, but we got it all handled, and they were so great. So it was such a beautiful moment, especially for the year that we've had.
Yeah.
You know, it was just so nice. So
It's a great ending to 2020.
I agree.
Mhm.
Love is in the air.
Yay.
Aw.
Yeah.
So did he make it through without crying?
No. They both cried.
Did you make it through without crying?
No, I cried too. I cried before it even happened.
No.
Yeah.
Was
Yeah.
there a crew there? Who was all there?
It was all the roommates.
Oh, yeah.
So there was about 5 of us.
Yeah.
And it was just such a beautiful moment.
Aw.
Yeah.
That's great. I love these feel good stuff.
I'm just ready for the super spreader comments to come through.
Absolutely not, Dr. Sarah.
Yeah.
So, well, I'll let you guys get back to it, but just wanted to pop in. I know this is our last Behind the Beauty of the year, and it's been so much fun for us, and there's lots of exciting things ahead for YovinoMD TV. So, just wanted to say hi and wish our Ideal Face and Body family happy holidays. And we're excited to keep it rolling in 2021.
Yay.
All
Us
right.
too.
I'll talk to
Tell
you guys.
Reed we said congratulations.
Yeah,
I
tell
will
us
do that. I'll deliver the message.
Okay.
Bye.
And his groom.
Wow.
Engagements all over. I'm shedding tears. So congratulations. So we were talking about all the changes that we've made, and virtual consults is another one from the office. It's like hard to kind of bounce back from that, but yeah.
What? Of what? No.
Off of engagement.
Just kidding. Yeah, I mean, the virtual stuff has been great for everybody, really, because the reality is a lot of what we do, and I mean, I have a lot of experience, so I can really tell what needs to be done almost like 99% of the time virtually with seeing the patient and talking to him and reviewing photos.
But paint that picture. So somebody goes online, they're like, oh, I want a consult. They go, they fill out the form, they submit their photos, and then it's the time of the appointment. You both go online via what? Zoom?
We go on Zoom, but let me just tell you what I do before I go online is I review, everything's put in our EMR, and I review what the patient has submitted. And sometimes it's just the online form, which is detailed, and they have areas where they can describe what they want, and I get an idea of who they are, and just demographics, how much they weigh, if they had kids or whatever.
Blah, blah, blah.
And then they submit photos, and so I'll review those photos, and then I fire up the Zoom, and I bring them up, and they come on, and I split screen with the Zoom and the chart, and so we get talking, and I go over all the stuff they submitted to make sure that I've covered everything, and that they can interject with more detail. And then
But do you ask them like, oh, I want you to be like in your kitchen or your bedroom. I want you on the bed. Like, what do you say? What do you say to them?
Jeez, so inappropriate.
What do you say? And do I need to be your chaperone?
So speaking of that, so Ashley is on with us during these
No, you're not answering my
consultations.
question.
Well, no, you mentioned chaperone, but yes, we have a chaperone in that sense. Ashley is there listening in. But I talk to the patients like regular, back and forth, and I review the chart. And then if a lot of times I'll ask them to show the body part or parts that they are wanting to address. And a lot of times they do. I mean, it's important for me, especially if it's a liposuction procedure. I want to see how thick that pinch is. So it gives me an idea of how much fat that is there in that area versus how much maybe little fat there is.
So
And it
what if
gives me
they
an
want
idea of
what if they want inner thigh lipo? What do you what do you tell them, like, what are they wearing? Their underwear?
yeah, their underwear. Yeah. Or they'll sometimes just pull it up and take. A lot of times, inner thigh, I go off by photos. I don't really have them like put the
This is my time to ask
front-
all the questions.
front center crotch shot, and unless they want to. Like, I have no problem seeing everything because it does make it more of a complete consult. But a lot of times, like inner thigh with the front kind of standard still photo is adequate enough for me to get an idea of what they need. For instance, I had one the other day who was a patient of mine we have done some surgery like 3 years ago. She was happy. She returned because she's lost a ton of weight, and we did it virtually, and she wanted to address her thighs and arms, and the photo she sent showed a lot of loose skin. She's older and she has lost a ton of weight, and so, I mean, the only option on her is a skin removal procedure, which is a medial thigh lift and a brachioplasty, and those come with scars, right? I mean, everybody loves a thinner arm and thinner thighs, but if there's a decent scar involved, then that's a game changer. And some patients are okay with it, and a lot of patients aren't. So I knew from the photos that that's what she needed to as a surgery, and so I brought that up and we talked about it, and that was not something that she wanted to do. So there was no reason for her to sit there and expose herself and all,
Oh, before you.
Yeah.
Is there ever a time where you see them online? You see online, and you do the consult, but then you see them in person. You're like, you didn't look like that on the computer.
No, that's their profile photo. Yeah. No, I mean, live and people send real photos. They don't send, like, I have not had a person send in a photo that is like not realistic.
Didn't I get tired of that hat last year for Christmas?
Yeah, maybe. So no, I have not had that as an issue. Once in a while, though, I will see a patient online, or I'm reviewing some photos and we're going to be setting up a virtual consult, and it's not so clear. Like, I can't tell if there's just enough fat to make a difference, or it's a breast lift, and you can't really tell exactly how droopy they are or not droopy. And I'll recommend that they come in and see me in person so we can really figure out those details. Or if their description and their expectations are a little bit off, or I can't see, it doesn't seem like I might not be able to satisfy them, but I can't say for sure, then I have them come in so I can see them in person.
Do you ever have to have them have a chaperone? Like they're even though they're on their computer, do you have somebody in the room with them?
No. I mean, we just have Ashley.
What's the youngest age of anybody you've done a consult with online?
I mean, I think maybe 18. I don't know.
Maybe 18. So they were 17 or 16?
No, I'm not even sure if they're 18. I mean, it's all been of legal age.
Okay, abstain.
Just kidding. Acting up.
Exactly. Okay.
Some BS.
Anyway, so virtual consults was something that we
I mean, that
was a new thing. I've even done virtual consults for people that wanted skin and to know what they needed for their face, to make their face look better. They feel like they look old. So we've done virtual consults like that.
You can do this with me?
I can't.
Yeah, you got to get in my rhythm. We're going to bang heads. You can't even get in rhythm.
Shut up. Well, am I supposed to go the same direction or opposite? Like...
No, you go together. Come on.
Anyway.
Listen, I love the virtual world for this setting because people are at home. They don't have to worry about driving in. They don't have to worry about being late and all this. It's so much more convenient for the patients. And I can actually
Happy holidays, Rose.
And I can actually see a lot more patients actually in a day for consultations. I think we can get through. I mean, the other day we saw like 15 or 16 from like 8 o'clock to 5 o'clock.
What's great is that in our office, since we are in the heart of the Golden Triangle in Beverly Hills, patients often have a hard time parking. And so they're 15 minutes late just because they get here on time, but then they're driving around finding parking, especially if they're in a prime time, like 10 a.m. to 2 p.m. They sometimes come late, so then it's a spillover of trickle down with all the other appointments kind of running later and this and that. So you're more on time now that it's all virtual. People have their set time, and you guys are running a lot more on time. It's great.
Yeah, definitely. Yeah, it's fantastic. And a lot of, in follow-ups too, like, I like seeing patients frequently if I can, but it doesn't necessarily mean you have to be in person, right? We can see each other and talk about and just get the history and stuff. So I see a lot of patients and virtual follow-ups, and it goes great. Today I saw a patient, a mother-daughter who both had surgery with me recently, and they both had their follow-up at the same time. And it's awesome. They were like, they're so great, right?
Yeah.
And they're also, one of them is also now Dr. Sarah's patient. She did a peel recently, and she's starting to peel. So it was like we both did it together, and it was fantastic, and I love it. And it was happy holidays, and all this stuff, and feel good.
Are you talking about what we do together?
What? We peel together.
What else have we done that's new? We started doing tattoo removal.
And how's that going?
It's going great.
Okay.
Yeah. Tattoo removal is a slow process. It's multiple treatments. For some people who saw some of the lives, we did Henry's tattoo on his face, and I've done Jasmine's foot.
Right?
I've done live. I've done those live.
Uh-huh.
Jasmine's foot, I don't know if I did live, but
You did.
I recorded it.
There was. I thought it was one live. Yeah, the tattoo removal. So,
our machine is only really equipped for blues and blacks. So people of color, it's not our tattoo removal.
People that have colors.
Colored tattoos.
Yeah. Okay.
Yeah.
Because I thought you said people.
I was like, I can't even talk anymore.
No,
about
I thought you said people of color.
No, I meant people with colored tattoos.
Yeah, so different blues and blacks. Good. Anything else? Reds? No. Right. We need a different laser.
Reds, whites, yellows. Whatever colored tattoos. I don't know what all the pigments are that people get in their tattoo, but.
What I think,
like Stacy's big old tattoo down the side of his body with that one with the 7 arms or whatever. Yeah.
The tattoo removal with us is unique because we can really numb the area without just putting topical, right? So if you need a block, if you need it actually injected, right, you can do that.
Well, that's one thing, but the machine that we have also doesn't damage the epidermis, which is great, because sometimes you see tattoo removal and people have, even though the pigment is gone, their epidermis is damaged, and you can still see the scarring from that. Our tattoo removal does not do that. How long does it take?
There was another question. Mrs. Mack said, so can you do Renuvion without treating during liposuction? So do you mean, can you do Renuvion without doing liposuction? I think that's kind of what you mean. I don't find that that's very effective. I find that you really need to be removing some fat and heating that space to contract it to get a result with the Renuvion. Just contracting a area without creating room for the contraction just doesn't seem to work that well. So I really don't offer Renuvion, so to speak, without doing some form of liposuction, at least making a space there. Now, Renuvion can also be used, just on a side note, for surface. So it can be used without liposuction, but this is a treatment that is not fat removal treatment. This is a skin resurfacing treatment. It's an aggressive resurfacing with the radio frequency Renuvion that essentially takes off the outer layer of skin. It's kind of like, if you heard of CO2 laser and really blasting the face, it's in that arena. It's not the same thing technically, but it essentially takes off the outer layer. It's really only used for what we say is Fitzpatrick 1, maybe 2 level of patients. These are really fair-skinned patients that
have no melanin.
That really have no melanin.
I wouldn't be a candidate for that.
I wouldn't really.
You wouldn't either.
But you might be able to. What's interesting about that device is you can set the power. Right, it's not just all one, right? It's you can set the power to really low, right? So I wonder in those settings, if you set it to really low and just kind of moved quickly, then you might open yourself up to
a lawsuit. I don't know if I do that.
That was quick.
Okay, anyway.
Oh, damn, that was good.
You know me. Okay, so that was tattoo removal. We also started this Behind the Beauty segment. Oh, wait. More
Hold
questions?
on. Yeah, that would say, how long does it take to heal from liposuction? I guess that's what it says, because it's all kind of jumbled up, right? Is that what you see back there? Yeah, I think that's what it says. Wait.
No, tattoo.
No, I don't know what it says, because it's your font is set too big again. How long does it heal? To heal from? I'm not sure. I can't read it. It doesn't. Maybe we can type that word again.
Well, let's just talk about how long does it take to heal from tattoo removal, which is just like a few, about a week or so. And then you get it done again and again. And then liposuction, how long does it? It takes 3 months to really start to see results, and 1 full year before you're final.
Not to really, no. So I never.
It's like 5 years.
No. So here's the timeline. Typical liposuction.
Yes, liposuction.
Oh,
right?
okay. So heal. So it's hard to know what you mean by that. Like, what does it mean? Like, when can you get back to work? When can you get back to the gym? When can you see results? All that stuff. So from a result standpoint, since she said that, typically at 2 days, I have patients take off their garment for the first time, and you will notice changes. Some patients have a more dramatic appearance at 2 days. Some have very little change at 2 days. It depends on the body area. Arms and thighs tend to be a little longer timeline to appreciate results. The waist and love handles and stuff tends to be more of a wow factor at the day 2 mark, but it varies in there. Usually patients are appreciating results by 2 weeks. Almost every patient's like, okay, yeah, either this is great, or yes, I'm starting to see it. Definitely by a month. By 3 months is when I'd say over 90% of the healing is done visually. And so that's when I like to take photos, put them side by side, and sit down with the patient and go over the results. There are changes beyond 3 months. It is usually very subtle, but it depends. If the patient's had multiple liposuctions before and it's like a revision of a revision, sometimes that can take a little bit longer, possibly, in how they heal, right? That timeline can vary. But in general, 3 months, over 90% of the healing's done.
Okay, that was one question. Then what else do we have?
I think that was it.
you.
Oh, so Mrs. Mack was saying,
friend wants to know if she has
skin. She was asking about the Renuvion without liposuction. Loose skin, just Renuvion by itself, I'd say is a no. It can be done, but you want satisfying results, and I don't think that gives much satisfaction by itself. Usually loose skin means it needs to be removed and stitched. It's like a loose suit, right? You can't really just stick it and cook it in a dryer and hope it shrinks down without losing the quality of things, and it really just doesn't work. So you gotta sew it, all right? So that comes with scars, and some are acceptable. Like a tummy tuck scar can be acceptable because you can hide it, although you can't hide the belly button scar. You can hide the lower one. Arm lifts, you're gonna see it, right? It's gonna be right here. Inner thigh lifts, you're gonna see it in the inside. So it all depends on how much loose skin you have and what you will accept.
And lasering and microneedling can help mute them. It depends. Like the lighter,
so the
skin
scars
tone.
The scars can be
I don't like garters,
for
but
scars.
scars.
For scars. You can treat the scar, but it's a project, right? It's not like, so for instance, you get a brachioplasty, right? And you're like, okay, when can I start treating the scar with laser, microneedling and stuff? I mean, the right answer is you wait 6 months to 12 months. Best answer is 12 months because you want the scar to kind of just settle down and kind of stop.
But you can start treating it with Silogen and other
yes, of course,
silicone creams and things like that.
I'm just talking about like procedures that really are more powerful. The laser comes in around 6 months to a year, and I always recommend if you're going to start doing those things, you kind of spot treat a portion of the scar and see what it does, right? Because if you blast the whole thing and then it tends to just pigment or like get angry,
and you do an IPL to get rid of the pigment.
I'm out of it.
Right.
I'm done.
Right. And then so then after that, another thing that was new in 2020 was that during COVID, you and I started the Behind the Beauty and our live. So you were going live with a bunch of different doctors. And then
we did some great ones. I was thinking about that the other day, where we did it with Desai and
Dr.
and
Gabay,
Dr. Gabay,
Dr. J,
Dr. J, and Dr.
Dr.
Meller,
Shimento.
Dr. Shimento. That was fun. We had a good time. We should do that more often.
That's where we split the screen.
When we get the time.
I know, right?
Come into town.
But that was really fun. And then we started the segment, and then we brought Ashley in, and then Ashley and I kind of took over a little bit, and then, and you're back.
I say back to the beauty.
That's right. And so we decided to change.
No longer behind.
We decided to change the name to YovinoMD TV.
Yeah.
And then the segment will be called Behind the Beauty. So we'll talk all things beauty. If you guys want us to review the whole, like, you know, what it's like to get surgery or any kind of surgery or body sculpting or skin treatments, we can go over whatever you guys want to talk about. And so we will be doing that and continuing that through the year. And then we started doing Botox banking for those people who wanted to, you know, we had stimulus packages during COVID. Right? Stimulus packages is what we called it. And we were allowing people to pre-purchase for Botox or syringes of fillers and things like that.
Yeah, so what's the Botox
discount.
banking?
Botox banking is when you're saying, okay, I'm going to make a commitment to this practice, and I'm going to prepay for my 100 units. And when you prepay for the 100 units, you get it at a discounted rate than if you kind of paid as you went along. So it's like a 30% discount.
Do they get like a little card? Do they get...
We keep it logged into their, like, we have a QuickBooks invoicing system.
Okay.
And we keep it there. And every time they come in, we subtract it from there. And then a lot of people will take a screenshot of that just so they have it for themselves. But we're, you know,
I was thinking like little cards, a little bank on it, like a Botox bank or stuff.
No, that'd be really cute.
You know, right? And you could write it, or you could punch, or I don't know. You know?
Yeah, that'd be a good idea.
Yeah, but I don't know if people will really keep that on them. You know, but they may.
Yeah,
you know, I mean,
don't want more crap.
I know, right? So
they take a picture, screenshot with their phone.
But maybe we could have something that they, you know, that would be fun to screenshot. You know, like that.
Yeah, like a stamp. Like get a stamp made. I don't know. We'll figure it out. Any suggestions, you guys? We're open to that.
Yeah, make it fun. Give it personality, right? You know?
Mm-hmm.
Not so stiff. That's so cold and frozen.
So inappropriate. Okay, and what else? So we're talking about things that are going to be new for 2021. What can we look forward to? What can we look forward to in 2021? Okay, so we're talking about new treatments. So I'm always looking at what's new and what's out there. There is a new treatment that we're looking into right now. It is an injectable that will help dissolve cellulite bands. So right now, what do we have to offer for cellulite? We have Sulfina. Sulfina is like a minimally invasive procedure that goes in and cuts the cellulite bands and releases them and allows the surface skin to smooth out. So we've always had that, but it is a procedure, a same-day thing with some downtime. You have to wear a garment for 2 weeks. Yeah. And now we're looking into actually an injectable.
Yeah, and so where are we at with that?
We've reached out to them, and we're waiting to have my first meeting.
Okay.
But that's going to be something new for 2021.
We have a new surgeon coming on board with us.
Ooh, did you read number 2?
Yeah,
we have a new surgeon.
Yeah, but I thought that, yeah. So, you know, listen, we're very busy, thankfully. And, you know, we want to help as many patients as we can. And
he wants every Friday off. And so he wants to
I can't work every day. You know,
yes,
you stop it. I used to work Monday through Saturday and operated every one of those days and doing 2 to 3 cases a day. And it's a lot, man. It's a lot, you know. And so I really pour my heart and soul into every patient, and so it takes a lot, you know. And we do big cases, we do complicated cases, and so those days get long. And plus, I got to be able to see patients for consults and follow-ups and all that stuff. So we have been working with.
Oh look, we have Cindy.
We have
Christine 378 has the filler in the bottle and the wrinkle. Oh, I'm sorry.
Jesus.
And hold on a second. And the wrinkle erase. Which do I put on first? You put on the wrinkle erase serum. So we of our product line, which is YovinoMD Skincare, we had to change the name to YovinoMD Beauty, and the wrinkle erase serum is the serum that you would put on first, and then you put the filler in a bottle over that. Both of them increase collagen and elastin. They're great. Okay, go ahead. I'm sorry. What were you talking about?
I was talking about adding another surgeon to our brand. So that way we can I know. We can offer more days for more surgeries, and also we try to have it a little more competitive, or pricing that is a little more available to everybody. So that's coming, and we're getting them on board hopefully within the next month or two. How much is it?
He's starting at the beginning of February.
Okay.
So and not
cases?
how long does that? Huh?
He's got cases scheduled?
I'm not sure if she's already, but she said he's starting in February.
Okay.
I think February 1st, because he's not available in January.
And he's been trained with me in precision sculpt. We've spent many cases together, and I've seen his work, and he's actually worked with us before for a brief time, and now he's available, and so it's great, and we're very excited about it.
So we have a question about non-surgical rhinoplasty. So that is, for those of you that don't know, it's when filler gets injected, or a nasal area. Usually people will get it right here, right there, the right or some people will get it at the tip. See how he has a droopy
No,
tip?
she loves to point that out. You love it.
And then we put it like so to make it look like that. Or some filler at the base to help raise the nose, or just smooth out some of the textural irregularities. It can last. I've had patients where it lasts years, like 2 to 3 years. It's not completely gone, because remember, filler will get absorbed in high movement areas much quicker than in areas that don't have a lot of movement. So like the lips, filler doesn't tend to last that long there. But the temples, it lasts a long time. Or in the nasal area, it can last quite a bit of time. So it depends. Everyone's a little bit different on how quickly they absorb it, but it can last, a year, 2 years.
And I think it lasts longer in the nose because the nose doesn't move around.
And there's not a lot of it's vascular there, but there's small vessels maybe. I don't know. Who knows?
Yeah, I mean, it could be some vascular component to it. Definitely some vascular component to it. Some circulation that kind of just, clears things. But I think movement is probably a big factor too. Where if an area is not moving, it tends to kind of stick around longer. If it's moving around, it tends to get contact with more surface inside, and there's more things coming involved, and it just.
And at this point, we charge per syringe of filler. So it depends on the filler used. It's anywhere between typically $900 to $1,000 for that procedure at this point. Okay, what else? So we talked about the new surgeon. He's coming on. He is trained from this office. He has done this procedure, precision sculpt, multiple times, and he will be a new addition to our.
And he cares for the patients, and he really likes. He takes pride in his work, which is extremely important for me.
Mm-hmm. And hopefully, I mean, I don't know for you guys who are paying attention to us in the past, and we had built this brand new office out, and that we weren't able to move in due to some issues the building had. Unfortunately, after I spent a year of my life working super hard to build this amazingly beautiful office, and that hopefully is coming to an end. We are in the final stages of recouping everything back from that, and we will hopefully have a new location coming up.
Yeah,
that's my plan, is that we will be moving.
Do we have?
No, we don't have
it.
the money to come back, Yeah. So hopefully that will be a change that we have coming up in the new year, among other things. There's always something, new areas for new growth. If you guys see things that you like from other places or other practices, or you notice that other states that they're doing it and you want to, just run it by us, please let us know. We are always looking for to expand and add to the practice. And
my grandmother says I have it, and I said 2 years. It was probably the non-surgical.
Right. She was probably
Oh,
we did hers. We did the first. We did I think Juvederm Ultra, and it lasted a long time. And when she came back, it hadn't it hadn't gone away completely.
Awesome.
Yeah.
Yeah, it's very satisfying.
It was good. So we didn't need quite as much the next time, which is great. It's a very, very satisfying. And people who have like downturned or they want a little bit of
here we go
upturn.
again.
No, this is Rudolph. Rudolph was playing right now.
Rudolph the red-nosed reindeer.
What else is
Rudolph the down-nosed reindeer.
Well, I hope you guys have an amazing holiday with your family. Is there anything that you want to show them? What's your favorite ornament on the tree? You want to pick your favorite ornament, show them?
Oh, God, I always have a hard time with that question in general. Like, what's your favorite band, favorite song, favorite this? I like a lot of stuff. So, I mean, listen, I got stories and I like them all. You know, of course, I love the Mammoth one, right? So, for those of you who know me or don't know me, I love snowboarding, right? I don't get Julie allows me to do it like
allows you
once a year now.
Like I got to say.
And
once a year.
Oh, you got
what are you talking
say
about?
all night. Even if I go, you say.
Such a liar.
So anyway, I love the Mammoth's great because it's you drive to it and we've been there a bunch. So I like that one a lot. I don't know the dolly lips are good too.
They're over there.
Yeah. What's your favorite then? I picked one out.
Well, I don't know. There's a few that we've gotten from around the world.
Oh, my mom. Mom finally came on.
Are you not gonna
Hey, Mama.
Hey, D Lynch 79. So we're just going over our favorite. Oops, I just spilled my water. I'm going over our favorite ornaments on the tree. So I was gonna pick out my favorite ones. So there's a few that.
Here.
Okay. Let me see. So this one I think is very beautiful.
Here, hold on.
Will you stop moving things around? You're hurting it.
You be quiet.
Okay, so this one I got from Gibraltar. Gibraltar. They actually hand blew this. I thought it was so pretty. It's not like red and whatever. Christmas. So I like that.
Here,
So that was my trip to England.
So they can see everything.
This one I got from Canterbury Cathedral in England. That was very pretty.
Look, Mom's woke.
Yeah. She was asleep. Fell asleep. I can't do that. Your mom. That was another one.
Let me see. This one I thought was great. I thought of you.
Okay, while you're picking that off. This one we got in Gioli in Chianti in Italy. It's I don't know what is this, ceramic or something? Metal, I don't know. But it's something, it's hand painted. And we went to Italy for my cousin's wedding and we got this one there.
Right, when I saw these and I got them for Sarah because she loves doing lips. And actually I got this, I was with you, Mom. We went to the Dolly Museum in St. Pete. And if you've never been to that, I know you have, Mom, but if anybody out there watching hasn't been to the Dolly Museum in St. Pete, you should really go. It's amazing. That guy was incredible.
And this one's really cute. This little gingerbread house I got from Moscatel's in downtown LA. And then remember this one we got in Reno on the way to Burning Man. Remember this one? We were on the way to Burning Man. We got this from the hotel in Reno, the casino. So that's our tree. What was the other one? Oh, we got this one. This one's cute.
And
we got this one in Mexico. This one in Isla de Mujeres in Mexico. It's right off Cancun. Island in Cancun. Oh, and I got this one. It's perfect because I'm Persian.
Sarah loves pomegranates.
So I love pomegranates, and I got this one in Granada in Spain, south of Spain. It was actually the Moors, which were where the Arabs settled in Granada, and they brought the pomegranate there. So they brought pomegranate trees. And
that's funny, Mom. I like that. Slap that at. That was good.
And That's it. I mean, those are the great ones. That's my favorite. I don't know if there's any other ones.
This one we keep putting back up here. Okay.
And then there's a donut one too.
Yeah.
So yeah.
All right.
All
Well,
right.
enough of us.
That's it, everybody. We all hope you guys have a very Merry Christmas with your family and your loved ones. And if you guys are Jewish, I know Hanukkah's over, but hopefully you had a great Hanukkah. And what are the other ones out there? Kwanzaa. And
Just happy holidays. I love this time of year because
there's UK Persian.
People are
you like my
friendly, and and it's like wish them well and have a good time and be with your family, and that's it.
Yeah,
I love it. All right.
Love from Beverly Hills. Happy
ya.
holidays.
Bye.
Bye. Love you guys.